Good day everyone, I am Shalami Y. Fortuito from 2AN. I'll be showing you how I do my Learning Outcome 7, Manage Healthcare Information in an Electronic Medical Record using the nursing process. Next, this activity, I will look for a partner from whom I can gather information and proceed with a typical health assessment, formulation of nursing diagnosis, nursing care plans, implementation, and evaluation strategies. Next, we can see here my workplace where I manage and input my patient's information with the website of openmrs.org. Later on, I will show you the whole process of inputting patient's data with the website of openmrs.org. For gathering information, health assessment, formation of nursing diagnosis, nursing care plan, implementation, and evaluation strategies with the patient. First, the nurse will introduce herself and give instructions to the patient, what will they going to do and what will the nurses will assess with the patient. In this phase, the nurse interview the patient to gather information, specifically the patient's demographic data, her contact infos, and patient's concern or complaint. Afterwards, the nurse will double-check the patient's information and instruct the patient to proceed to the next assessment, which is taking her vital signs. After taking patient's vital signs, the nurse will double-check and validate the information, and the nurse will instruct the patient to wait if there are other assessments to do. Next, here we will proceed on inputting patient information to our website. So first, access the website openmrs.org, then type its username and password. So we have here the admin for the username and admin123 for the password. And select for location for the session, the inpatient ward, and then log in. After we log in, we will see here different inputs where we can demo such as find patient, active visits, register a patient, capture vitals, appointment scheduling, reports, data management, configure metadata, and system administration. But before anything else, we will proceed to register a patient and fill up the demographic profile of our patient, contact information of our patient, then the relationships. Before confirming, we should recheck the information that we put for registering a patient. Afterwards, we will select the confirm. Then next, we will see here we already created our patient's record. So let's proceed to start visit. So after clicking start visit, we will see here that there's no diagnosis yet for our patient. Then let's proceed to capture vitals. We will input our patient's vitals here, the height of the patient, weight, calculated BMI, temperature, pulse, respiratory rate, blood pressure, and oxygen saturation. After we input our patient's vitals, before we confirm, let's recheck or double check first, then confirm. After capturing vitals, we will proceed to visit note. Then we will add our patient's diagnosis. And after adding patient's diagnosis, we will proceed to clinical notes. We will add our nursing care plan, nursing diagnosis, goal, and intervention. After finishing our visit note, let's proceed to attachment where we can attach our file for our nursing care plan. After that, we can proceed to admit to inpatient where we select the admitted by, then we choose the location of the ward and save it. Then recheck again. Next, here we can input patient's appointments, add past visits. We can also select patient's conditions. And also patient's allergies. So afterwards, after inputting all the conditions of our patients, all the informations of our patient, we can save and end our visit. I have also used different websites such as PubMed to gain more knowledge about our patient's conditions, and Unilab for more information about our patient's medicines or its dosage, side effects, and many more. Uses of an application to download patient care. Uses an application to plan care for clients to include discharge planning, uses an application to enter patient data, uses computerized patient monitoring systems, uses information management technologies for patient education, evaluates health information on the internet using structured critic format, maintains privacy and confidentiality in the clinical log management. I suggest you will have this Hippocrates application.
Our clinical intelligence tool, Epocrates Plus, is America's #1 medical app. With easy navigation and comprehensive yet concise information, Epocrates Plus is an indispensable tool for today's healthcare provider. Using your smartphone, you can review prescribing and safety information for thousands of drugs, including alternative medicines. Check for potentially harmful drug interactions among up to 30 drugs your patient may be using. Access thousands of disease monographs to help in your diagnosis and selection of treatment. And with Athena Text, you can send secure, HIPAA-compliant messages to your care team, inside and outside your practice. Use our coding bundles to help decipher the complex world of ICD-10 and CPT codes. Quickly navigate Epocrates guideline synopsis for authoritative, evidence-based recommendations arranged by specific patient type. Having the latest curated clinical content in the palm of your hand saves you time and helps you be even more present for your patients in the moments of care. That's Epocrates.
That's all for my LO7 Manage Healthcare Information in an Electronic Medical Record using the nursing process.